Good afternoon, everyone, and happy Friday. So, welcome to Alpha IVF Women Specialist Facebook Live. So, my name is Putri, and today we have Dr. Lau Wilkia and Jenny from 1TCF. So, our topic for today is about PCOS and acupuncture. So, if you have any questions later, you can just drop your questions in the comment section below. Okay? All right. Okay. So, Dr. Lau, thank you for joining us today. Can I ask you what is PCOS?
Good afternoon to everyone. I'm Dr. Lam from Alpha IVF, Dr. Damansara. So what is PCOS? Yeah. PCOS stands for Polycystic Ovarian Syndrome, or we call it PCOS. It's a hormonal disturbance condition that affects a large portion of women.
Is PCOS is a common disease for women, or do you think like it can happen to anyone?
Yeah, it can happen to everyone. Actually, PCOS is quite common. It affects 10% of all women of reproductive age group. It's quite common, 10%.
What about Jenny? What is DCM?
PCOS is actually this long name for Israel is traditional Chinese medicine. So it has a history of about 2,000 years back. Yeah, it's a medicine formed through observation. And what our ancestors they did was they observed the nature and then how the nature changes our body. And so they formed this theory through observation and also categorizing all the nature that they found. So some people, for them, they think that PCOS is only about heatiness. Yeah. And maybe sometimes when you have headache, you tell your mother will say that you are heaty. So they ask you to drink a lot of water. Or you're coughing, they ask you to drink water. Yeah. So actually, PCOS is not only about heatiness. We have coldness also, dryness, dampness. Sometimes it's about efficiency problem also. Yeah. Then PCOS is about qi, yin yang, or this.
I see. Yeah. How does PCM theory form?
Actually, we believe that this year, the whole world is a formation of one energy where we mimic qi. Okay, so this qi, we have after observation, we found that there's two types of qi where we mimic yin and yang. Okay, so yin and yang is two opposing energy lah. And in this yin and yang, they are opposing, but then they cannot be separated. So actually, yin and yang, they have to be balanced in our body. Yeah. So it's very important for the yin yang or qi and blood in our body to be balanced. If it's imbalanced, it will cause disease in our body. Yeah. So what this year do is we'll balance everything that's imbalanced in the body.
So the doctor, what are the symptoms of PCOS? How do I find out like if I have PCOS and what should I do about it?
Actually, the symptoms of PCOS women can present in a wide range of symptoms. It varies from one individual to the other individual. So the commonest symptoms is the irregular menses or menses disturbance. Some of the women they have the menses are heavier or lighter than normal, or no menses at all. All because of due to some ovulation dysfunction. The other symptom is most commonly is due to abnormal hair growth, or we call it hirsutism. 70% of the women can have an unwanted hair growth, especially over the chins, over the upper lips, or chest wall, or other parts of the body. Become very heavy. The next symptoms is overweight or obese. So half of the PCOS women will present with a weight gain tremendously and become obesity. Of course, the last one is they will present to us with infertility. They are trying and still can unable to conceive. That's why they come for assessment.
But if I don't have the system, does that mean I'm free from PCOS?
Because PCOS is not a disease per se, it's a syndrome. Syndrome meaning that individuals are very. Maybe you don't have a menses problem, but you have a polycystic ovaries. You're not presented presentation is not pronounced. That's why you still as a normal until you have a maybe you suffer from a infertility problem, then you seek for the assessment, then you find out, oh, actually I got a polycystic.
Then Dr. Lam, how can PCOS be diagnosed?
Recognizing symptoms is very important, as I said, but unfortunately the symptoms are varies. The diagnosis of the PCOS, we got criteria to fulfill. 2 out of 3 criteria, as I mentioned below. The number 1, if you have an ovulation or the ovulation problem, meaning that your menses disturbance because of the hormone imbalance. Number 1, your presenter with the menses problem. Number 2, from the blood test, your male hormone is quite high in your body. We do a blood test. Thirdly, do a scan. By doing the vaginal scan, we notice you have a polycystic ovaries. Actually, many women will think that polycystic, you will have many cysts in the ovaries. Actually, it's partly true. The cyst actually will refer to the follicles. There's a lot of follicles. Follicles means a sac containing the eggs. There's many, but they're unable to grow, mature, or become a dominant follicles, all remain is a baby size, and yet they cannot ovulate. Hence, it lead to all the problems as hormone disturbance, and ovulation, period doesn't come, and so on. If you fulfill 2 out of 3 of the criteria as mentioned, we can officially diagnose you have a PCOS.
Okay, for example, for me, like myself, like I'm not married, and like, how do we detect like whether through the vaginal scan? Like, can we do this moment?
Abdomen is very difficult because from doing the abdomen scan is because the ovaries is hiding behind is a pelvic region. By doing the abdomen scan is very difficult to visualize, to see the ovaries, especially you want to diagnose is see all the cystic lesion inside the ovaries, unless you have already team. Because as I mentioned, all the most likely the PCOS woman is really overweight.
Yeah. And then, so then, how does TCM view of PCOS, and how do you?
Actually, in our ancient classics writing about Chinese medicine theory, we don't have records of PCOS because PCOS in the history of PCOS is not very long ago. Then actually last time also they don't have the ultrasound scan. They can't see if there's any cyst, and they don't have hormone test also. So similar symptoms that we can find in our Chinese medicine theory is that in the chapters of infertility, irregular menstruation, and also amenorrhea. Okay, so what we do in PCM is that we do categorization in when we diagnose a patient. When they come to us, we do consultation. During consultation, we will do consultation on their symptoms, taking their pulse, reading their tongues, and then also observing their complexion, all this stuff. Then through that, we will see how's their condition, and we group them into syndromes. Okay, so like I said just now, what we do is we will balance what imbalance in their body. So if these syndromes could be we differentiate to 2 types, where there is excessive syndrome and also deficiency syndromes. Okay, deficiency means like maybe their yin or their yang in their body is too low. Yeah, and this will affect their body problem. Okay, so the first type that is very commonly seen in the PCOS ladies is kidney yang deficiency. Okay, a yang in our body is very something that it is responsible in regulating our functional parts of our organs and also our body. Okay, so if our yang is too low, the functioning of our uterus, it will be low also. Okay, so a kidney yang deficiency patient, they might have symptoms such as infertility over long period. Okay, they may be bigger in size. Okay, and then they may often they have a waist soreness problem during their menstruation. And then another thing that you can observe in kidney yang deficiency patients that they'll be more afraid of cold when they compared to others. Yeah, so in echo you will see this kind of people, they'll be very, very sick. Yeah, and then they will prefer to drink hot water. Yeah, okay. So the second type is kidney yin deficiency. So when yin is low, you see if yang and yin, if yin is low, then you can see that relatively the yang is high. So that means that they will feel more hot, these kind of people. So they are more tends to be more heaty. Yeah, these kind of people, they will be more heaty. So they are the one that when you are in the echo, the one that is saying is very hot, then this kind of people is yin deficiency. Then yin is responsible for the physical form of substance. Okay, so yin is responsible in nourishing our body for the nutrients part. So if yin is insufficient, it could cause that your menses to be very little. Then yin deficiency, because it's responsible for the physical form. So people with yin deficiency, they could be smaller in size.
Smaller in size.
Yes. Yeah. Okay. And then the third one that's very common in PCOS is excessive dampness in the body. So like just now, Dr. Lam said that polycystic is that they have a lot of follicles in their ovary. Is filled with fluids, right? So dampness is actually unwanted water accumulation in our body. So this kind of people, this is the most common type for PCOS. So this is the reason why there's a formation of these unwanted follicles in their ovaries. So dampness is because it slows down everything in our body, the qi flow, the blood flow. So this will cause these people to be really heavy, they feel really heavy, they might be more blur, yeah, that kind of people. Okay, then people with excessive dampness, they will be bigger in size, so they are more tends to have excessive weight gain. Okay, and then if dampness over long time, they could develop into something more severe, what we call damp heat. Yeah, when dampness it made up together with heatiness, it's very hard to get it eliminated. Okay, so this kind of people, they might have excessive hair growth, they have oily skin, yeah, and then they have a lot of vaginal discharge. Okay. So after that is liver depression. So liver is responsible for the overall qi mechanism, the qi flow in our body. So if our liver is depressed, then it will cause the irregulated qi flow in our body. Then it will affect the meridian's qi flow. So if our meridian qi flow is not smooth, then it will cause unsmooth menstruation. And so people with liver depression, they will have irregular menses. And then also because liver meridian has to rest, so these people, they are more tends to have breast distension during or before their menstruation. So the last one is blood feces. Blood feces, these people, they tend to have hypomenorrhea or they have pain during their menstruation. So in Chinese medicine, we say that when there's blockage, so when there's unsmooth flow of blood, then you have pain problem. So you have this menorrhea, and then when you these are people, they are tends to be more irritating. Yeah. Okay. So after knowing what is the causes to their problem, okay, called moxibustion as well. Yeah, all this we can use to treat. So it's like for example, like just now for deficiency syndrome, we use this treatment to tonify them, and also for the the excessive syndrome, then we will eliminate what is unwanted in our body. So through all these treatments that we give, what we aim to do is that we want to balance up the hormone secretion in their body to make it back to normal, so that their menses is regulated. Yeah, after their menses is regulated, then the ovulation can be back to normal. Then only they can get help with their fertility. And also with this, you will have a more stable emotion. Yeah.
So for Dr. Wang, okay, what do you think, how does PCOS affect fertility?
Of course, the PCOS, a lot of PCOS women, they do have some infertility issue. So how does it affect the fertility? The first one, if a woman with a menses disturbance, meaning that most likely the patient cannot regularly ovulate. So it's an ovulation problem. If the woman doesn't have a regular ovulation, meaning that there's no eggs being produced, no eggs being produced, then it's got no chance to get pregnant. Is the first one. Because of women with PCOS, it usually affect the endometrial lining. The lining per se itself of the uterus will not conductive or very receptive to the implantation. Thirdly, the PCOS woman, as I mentioned before, we presented with obesity or overweight. Of course, the overweight and obesity itself also can reduce the fertility properties.
Okay, all right, so we're gonna take a break for 2 minutes and then we're gonna continue later, okay? Okay, we are back. Okay, so now we're gonna could you explain more about acupuncture?
Okay, what we do in acupuncture is that we insert a very thin needle. Okay, prepare some needle here. So it's very thin needle. Yeah. So the most common question that patients are going to ask us when we tell them acupuncture is that will be like acupuncture needle. Is it very painful? Actually, it's not so painful because needle is very thin. It's so fine that something as thin as our hair. I'm going to open. Then, so what we do is that when we use these needles, we we put it in according to the acupoint chart. Okay, so acupoint is that they are similar with herbal. They have function as well. So some acupoints they can fortify our kidney, or some acupoints they can help with regulating our digestive system, and some they can help to resolve dampness in our body. So we'll choose the acupoint according to our diagnosis earlier. Okay, so I have here if you want to try. Okay, let's try.
So let's see how this works.
Give some feedback.
Yeah.
This is a very common acupoint we use to treat headache. Then sometimes we can also use acupuncture to help to make the patient relax. Yeah, when they are too nervous. Do you feel? Yes. Sometimes you feel soreness or numbness after we poke the needle. Is it painful?
No.
This means you are very healthy.
Yeah, there are some points that it is very painful when they have blockage over there. Yeah. Any feeling?
So, okay, Dr. Lau, okay, what can I do on my own to lessen PCOS? What are my options?
If you have a PCOS, depending how severe and your presentation and the symptoms you presented. If you have a menstrual irregularity or disturbance, of course you need to seek for one of the gynecologists to find out to diagnose whether you have a PCOS or not. Menstrual disturbances may be due to other reasons, such as you have a fibroids or other problems or other hormone imbalance. These are the PCOS. That's the first thing you need to seek for your gynecologist to have an assessment. If the doctor said, oh, you have a PCOS, then the options you have, usually the doctor will advise you to have a lifestyle modification or the diet modification, meaning that to maintain or reduce your weight. Studies has shown that if you reduce your current weight by 5%, if you suffer from the end ovulation or ovulation dysfunction, your body will automatically reset and you can ovulate by yourself. There's a simplest way you can do, such you can adopt exercise, some therapy, some diet control, then you can reduce your weight. This is the easiest way. Of course, the treatment for PCOS is comprises of the medical or surgical or combination of two.
Okay, let's say if I have PCOS, can I take any supplement myself?
Usually the supplement you take, usually the doctor will advise you to take the metformin. Metformin is one of the agent. Actually, the metformin is to how to say, to adjunct. It's an adjunctive treatment. It's not a treatment for the PCOS. The mainstay, the purpose of giving the metformin is to make you more sensitive to the insulin, because most of the PCOS have an insulin resistant syndrome. The metformin, the purpose to make you more sensitive to insulin, and they will maintain to help you or to facilitate you to make you to have your weight control. By the taking the metformin per se itself, it doesn't increase your pregnancy rates. You must have some fertility treatment together with metformin, then they can increase your fertility chances.
If I have a PCOS doctor, should I see a fertility doctor before trying to conceive?
PCOS woman, majority of the PCOS women, they they rarely need to seek for the fertility treatment. Most of the PCOS women can conceive naturally. But if you suffer from the menstrual irregularity or menstrual disturbance as a consequences of PCOS, then you need to seek for the fertility assessment. Because we are not ovulating, meaning that you've got no chance to get pregnant naturally. You need to take some medications as a ovarian induction agent. The most commonly used is promitin to stimulate your ovaries to ovulate.
For Jenny, do you think is it safe to use herbal medicine during pregnancy?
Yes, it's actually very safe. I have been using herbal medicine for my patient to help with preventing miscarriage, and also sometimes during pregnancy they will have morning sickness, and sometimes they couldn't even eat. Yeah, so it's quite effective in using herbal medicine to treat this kind of problem.
Can herbs cause the defects?
There is no such data shown that eating herbs during pregnancy will cause birth defect. But it is very common that it's very often I have patients after they take the Chinese herbs during pregnancy, it helps with them to feel better. Yeah.
So Dr. Lai, will having PCOS affect the outcome of my IVF?
The answer is will affect your IVF program. Okay. The good point is PCOS woman, you've got a large number, more than usual, instead of the number of the eggs. But in the study said that most of the eggs quality itself, maturity, some say is not optimum in the quality itself. You have a lot of eggs, of course. Actually, IVF is a number game. You've got a lot of eggs. The chances you obtain a good quality blastocyst, the chances is better. The chances is higher. Of course, before you embark on the IVF cycle, if you have a PCOS, we do recommend to take some supplement in order to improve the quality of the eggs. That's a supplement you can take. It won't affect your IVF outcome, but you can improve your IVF journey by taking some medication and do some adjustment. Of course, one of the traditional, you can take some traditional medicine, the acupuncture. Actually, acupuncture can improve in some ways in the IVF journey. It not directly improve the success rate, because most of the couple undergo for the acupuncture, they are more relaxed, they are mentally more stable or energetic, they accept the outcome better. That is for sure. And the acupuncture can improve the circulation of the ovaries, of the womb. In my knowledge, is make your womb more heat.
Yeah, more warm. Because many ladies they have what we say coolness in their womb. Yeah, that one is causing infertility.
In Chinese, we believe that we have a warm uterus, the inflammation is better.
But do you think that some NCTs are more prone to PCOS?
The study show that the established study has shown no discrepancy between the ethnicity. Either you are Malay, Chinese, Indian, the appearance or incidence is still the same.
Okay, so if you have any question, you can leave your question in the comment section below and we'll answer your question. So Jenny, do you think like okay, how do you convince people like me and then like to go for acupuncture? Because nowadays like mostly that my generation, my age, so takut like to go to acupuncture.
Because of the
Yeah.
as well as IVF
So you try
cycle.
already?
Can.
IVF cycle also order injection. So now, how do you commit this?
Yeah.
So then also need
actually acupuncture so can help to strengthen because men mostly their problem is with their bones, right? Actually, by through TCM treatment, it can help to regulate the problem. Yeah, because in Chinese medicine, we see that when they have this stone problem, it must be kidney deficiency. Yeah, so they can go through either herbal treatments to tonify their kidney to make their kidney stronger, or they use acupuncture. Yeah.
So how do you convince?
The first one is like just now I like to try, then it's not painful. Yeah. And then I think maybe sometimes most youngsters also they don't know what acupuncture can do. Yeah, so acupuncture is most known for treating pain problem, pain management. Yeah, so it's very effective in treating pain problems. Like sometimes maybe the efficiency can be up to like maybe few minutes, 10 minutes that I can treat the pain.
Okay, like for first timer, okay, do you suggest like for acupuncture like which area first or do you like to go through like because I saw through Instagram like people like put needle everywhere.
That one depends on what you want to do lah. That one, I think the one you see is face acupuncture for aesthetic. For aesthetic. Yeah. For normally what we do is we do body balancing. So body balancing means we can make them relax and to balance overall yin yang and qi in the body. So what we do is mostly some acupuncture on the head, then on the abdomen, then maybe a few on the limbs.
So Dr. Lau, we have a question. Okay. PCOS affects my period cycle. What can I do?
Depends on what's your main concern. If your main concern to regulate your menses, you can take some birth control pills to regulate your menses. If your main concern is for fertility point of view, so you need to come approach a fertility specialist to have an assessment for the further assessment, and the treatment will tailor according to your problem.
Okay. Position like okay, let's say I have my period cycle is not normal due to PCOS. So what can I do? Like, should I go like
if for those PCOS patient with overweight problem, then what we will focus first is to help them to lose weight through using acupuncture. That is very important, and because like just now I said, fatness, yeah, it will cause the problem in the ovary, right? So if there's no ovulation, also it will cause menstruation cannot come also. Yeah, so the first thing is to lose weight lah.
that's a very big thing to do. Okay. So if there is no other question or our session has come to an end, before we close, I hope that you have been benefit from today's session. If you know someone who is going through this PCOS, or you find yourself is having this sign and symptom, I encourage you to take the courage to come to book appointment with our doctor. And then thank you everyone for joining us today. Don't forget to like, follow, subscribe our Instagram, Facebook, YouTube channel to receive notification on latest events and promotion. Do let us know in the comment if you want us to discuss any other topic from next live session. Thank you.